I heard once that dentists are the ones who die sooner than most other physicians,
True.
that dentists retire earlier than most
Hmm.
other physicians, that it affects their brain, like you
Hmm.
mentioned, the positive thinking versus the negative feedback you get a lot. And you know that certain procedures hurt, and
Hmm.
so or they will hurt afterwards. But that is there a truth to that? That dentists are suffering more from it, or do you
Hmm.
feel since the introduction of the zirconia
Hmm.
fillings that some of that has been diminished?
So all of it's kind of a interesting subject. So we do have high suicide rates. We don't have the highest anymore. It is a very challenging environment to be around for any human being. So you have to create an environment as a dentist in your practice that is uplifting to you.
Correct.
I have a good time in my practice. I laugh with my patients. I don't do stress. I don't do stress for them or me. If I don't work well with staff, then we get people who can work well with us. I
Mm-hmm.
only work as much as I can to enjoy what I do.
Mm-hmm.
And I don't work on patients. I don't cause pain. If you're not comfortable, if you're not numb, we don't work on you. There's things you have to do to make dentistry as enjoyable as possible.
Mm-hmm. Mm-hmm.
Secondly, we don't use toxic materials. I haven't used toxic materials ever in my practice. So we don't use mercury. We use certain types of plastic fillings that are filled with zirconia
Mm-hmm.
instead of plastic, right?
Mm-hmm.
We use the healthiest materials that you can find, constantly changing. We use a lot of protection. We use suction machines for removing mercury. We isolate the tooth with rubber shields when we do mercury filling removal. We don't expose the patient or us to mercury vapor. We don't do root canals. We don't we don't use metal.
Why
Um,
do you smile when you say we don't do root
oh,
canals?
because I get attacked about root canals all the time.
You get
Oh, oh
attacked?
my gosh, yes.
What do you mean attacked? By
Mm.
patients or by
Oh no, no,
professional
no.
other colleagues?
Endodontists, colleagues. Well, the root canal industry is huge. It's huge. It is a multi-billion-dollar industry, and the endodontists are so powerful. When you bring out a documentary,
An endodontist is
oh,
somebody who
a
does
root
root
canal
canals.
specialist, yes.
Okay. Mm-hmm.
So you bring out a documentary on Netflix called, The Root Cause.
Huh.
The root cause. It was called The Root Cause. It was a
Okay.
great documentary. They were able to get it off within a month.
Wow.
Yeah, they were able to get it off within a month, and
You mean get it off?
get off Netflix. You have
Get
a
it
hard
off
time get it
Netflix.
off Netflix
Oh,
within a
I thought
month.
that it took them a month to make it. That's how
No,
good
no,
it was.
the documentary is a great documentary.
Yeah.
It's a
Okay.
wonderful documentary. But the endodontists, the root canal specialists, were so upset they got that thing taken off within a month.
So.
And so now when anybody mentions anything about root canals possibly being bad, and I'll give you a really good example in a second. Number one, you're going to be on a list. Okay, you're going to be shadow banned on social media. You're going to receive nasty messages on DMs or on comments, and possible litigation. I mean, Hal Huggins destroyed, right? You know how that whole goes.
Interesting.
So here's a good example why this doesn't sit so well with me. And I have endodontists who are amazing people, good friends of mine. I just don't agree with what they do. In the mouth, there's something called the focal infection theory. You've probably heard of that.
Mm-hmm.
That means that if you have an infection somewhere in the body, bacteria, it can travel to a different site in the
Organ.
body, right?
Yeah. Mm-hmm.
Like taking a ride in your bloodstream
Yeah. Yeah.
and
Yeah.
affecting a different part.
Yeah.
So if you have a knee replacement
Mm-hmm.
in the body,
Mm-hmm.
and I am going to work on you as a dentist, there is a link to the bacteria in your mouth somehow getting from the mouth to your knee. And so we were supposed to give you antibiotics when we work on you to prevent this bacteria getting into your system and traveling to the knee.
And
Focal
thereby
infection theory.
rejecting the. Oh. Okay.
Yeah, just living around the knee causing an infection.
Yeah.
So that's called the focal infection theory. The infections in your mouth,
Yeah.
gum disease, whatever they may call it,
Mm-hmm.
travels clearly to your heart valves.
Everything goes through the heart.
Clearly to your organs, to your brain, to your joint replacements. All that has been proven.
Huh.
The endodontists, the root canal specialists, vehemently deny that any bacteria that could be part of that root canal leaves that root canal ever and travels anywhere else. There's the focal infection theory doesn't exist for root canals. They're like exempt. Root canals are exempt from the focal infection theory, but everything else in the body is affected by the mouth. So does that make sense?
No.
Is that like maybe you're trying to protect your profession in sacrifice of the patient?
Yeah.
It doesn't sit well with me. I can't subscribe to that. Okay? When I see massive infections around roots, dead roots, root canal teeth, massive infections, patients come in with incredible health issues that get resolved when I remove those infections.
So.
Not by redoing the root canal, not by giving them antibiotics, but by removing the source, the dead organ. And they get better. Okay. I had a patient last year. I did a video on her.
Oh.
And she let me publish everything. She came in, she had major issues in her life. She was borderline considering ending her life.
So.
Because of all this. She had acne, terrible cystic acne on her face. Tried everything. She did the Pomka protocol. She did everything she could.
Dr. Pompa?
Yeah. He's a great detox protocol.
Yeah.
She did protocols like his. She did all the skincare you can imagine. Nothing was getting better. She's seen dentists. Everything looks fine. Everything looks fine.
So she
comes to
was
see me.
already aware. She thought there could be a connection with my teeth.
There was a
But
naturopath
she was,
that told her. A naturopath told her to see me here in town.
Yeah.
She didn't really connect the mouth issues until she said she looked at the root canal teeth and saw purple or bleedy purple gums around them, which is very common. And to her, that was a warning sign. To the dentist she was seeing at the time, it was normal. They didn't take what's called a 3D or a CBCT scan, like a CT scan of the head. So she was referred to me. And the first thing we do, of course, we listen to her. You're not crazy. Something is wrong. Then we do a CBCT or a 3D scan to look at all different angles of all the teeth. Her infections were some of the largest I've seen on her 2 teeth that were root canaled. No other dentist found them. They took simple 2-dimensional x-rays, and sometimes it doesn't show up on those x-rays. Okay? So she was told it's fine, it's fine, it's fine. I look at it. Some of the worst I've seen. Long story short, we end up removing those teeth biologically. When the tooth came out, immediately she started to weep. She cried. She said she felt her body release the toxins. And I've had this happen many times. It sounds strange, but you feel the relief. Your body feels the release of the poison.
Oh.
And it's an emotional release. Within a week, her acne started to go away. Within a month, no acne.
Huh.
Her mental health, she had difficulties thinking, major brain fog. Everything started to clear up. Her entire life changed. So it's a really interesting story. And it's not an isolated story. This is something that happens all the time. So that is real world experience.
You say biologically extracting a tooth. What does that mean? How is that different than extracting a tooth?
So let's talk
What do
about
you do biologically extracting it?
what's a biologic dentist, right? What's a holistic dentist? What's the difference? In an ideal world, every dentist is a biologic dentist. Do no harm, a holistic dentist. Don't put poisons in the mouth. Listen to common sense research. Put the patient first.
Yeah.
Biologic dentistry, biomimetic dentistry.
And I would
All the
also,
same.
if I can add then to it, it would also be that the mouth is part of the whole body. And so when the mouth is affected, parts of the body could be affected. So biologically, you look at the person as a whole. You listen to what their story.
Yeah.
You listen to their emotions. You observe things moving in the body, and so you look not just as an isolated tooth, but how the whole how everything is connected.
This is
I
not
take it.
separate, right? This
No,
is not, the
exactly.
whole idea, dental insurance versus health insurance. It's a joke.
Yeah.
This is the entry portal, okay? Health starts in the mouth. It really does. And so if you're a biologic dentist, you're a holistic dentist, you simply don't put toxins in the mouth. Number one, we don't use mercury. We don't use known toxic materials that are in plastics. We use zirconia instead of titanium for dental implants. We use strong precautions when we work on you to not poison you with the materials that we're taking out of your body. We use a smart protocol for removing mercury fillings, safe mercury removal protocols, okay? And that means isolating the toxins from the body, cutting around the filling instead of pulverizing the filling, taking the filling out in one piece, putting it into a hazardous material bag, because we have to, and then putting chlorella into the tooth to pull out all the
The
toxins
heavy
that are
mercury. Yeah.
chlorella mixed with ozone water. Kill the bacteria, pull out the heavy metal toxins. Now we have a healthy tooth. Then we rebuild that with something that is biologically compatible, not poison.
So how do you put chlorella in the tooth? Is it literally chlorella powder mixed with something?
Yep, we mix the chlorella powder with ozone water,
Yeah.
and we create a paste.
Okay.
We have it isolated with a rubber shield. We put it into the tooth. We wait 3 to 5 minutes. Then we wash it out. All the heavy metals get washed out, suctioned out.
It happens that quickly.
Happens that quickly. Millions of tubes, right?
Uh-huh.
We use those tubules to bond, to stick to the tooth. But the tubules are filled with mercury and with all the byproducts of all the bacteria. We want to get that out. So we kill it with ozone water, all the bacteria. And then we pull out all the heavy metal toxins. And then we put a healthy filling in the tooth. It doesn't take but an extra 3 minutes. Why would we not do that? Right? And then we give the patient a pre and post-op protocol to try to further detox the body, right? And there's many different ones. They all work. But chlorella is easy. It's cheap.
Yep.
Everybody has it. It doesn't overwhelm the body. So 12 chlorella tablets at night make wonders, for removing mercury toxicity. So that's just mercury. We don't use metal in root replacements. We don't use titanium.
Because the body naturally doesn't have metal.
Titanium is not biocompatible. It's only biocompatible because it's coated in a layer of ceramic. People think titanium implants are biocompatible. No, the titanium isn't. It's the coating on the implant. The coating is ceramic. So we use an entire ceramic implant. 100% compatible. It looks better. It's white versus being dark. The blood flows around like a normal tooth. It loves the ceramic.
Yeah.
It grows into the ceramic.
Yeah.
So we use ceramic. Ceramic is less than 1% of the dental market in the United States. Think about that.
Interesting. Wow.
So biologic dentistry is new.
Yeah.
We're still introducing it. In Europe, it's way advanced. But here, we're still doing 99% titanium. Why? Cheaper, quicker, you know how to do it. It's just like teaching an old dog new tricks. They don't want to learn. And it's a business. They don't care.
Yeah.
So if they really cared and they did the research, they would use zirconia. So that's frustrating. We use ozone instead of chemical mouthwashes. Ozone is a wonderful way to kill bacteria. When we
Exactly.
yeah, it works great. And
Yeah.
the reason you don't see it everywhere is because it turns into air and water. You can't sell it on the shelf as a mouthwash.
No.
So you can't make any money off of it, right?
That's true.
It's not a pharmaceutical product.
Yeah.
You have to make it fresh. So
Yeah.
of course they're not going to like that. It's not a pill. It's not a mouthwash. So we use fresh ozone water with every patient. So when you have a tooth removed, and if you don't do it biologically, meaning we don't prepare the body, we don't make sure that you are ready to have this performed. If your immune system is compromised, if your vitamin D levels are below 60, you're not going to heal.
No.
You're not going to heal. And if you don't heal, the bacteria that's left in the socket when you remove the tooth win. They create a beautiful little nest that then gets covered up by tissue, and now you have a permanent bacterial nest in your body.
Wow.
That's not a good thing. That's
No,
terrible. That's
no.
called decapitation.
Yeah.
So we make sure you're healthy enough to have procedure done. We give you certain vitamins and supplements beforehand to boost your health. We make sure that when you have it done, you do the same thing. We do an IV. Vitamin C, glutathione, magnesium.
Is that right? You do all that.
So you get
Wow.
an IV
Wow.
to boost the health of the body immediately.
Yep.
Because all this stuff is going into the bloodstream.
Yep.
So your bloodstream is covered. We do the procedure atraumatically. We don't use a ton of anesthetic. We just use it in the right place, right? Because you need blood flow for the procedure to heal. So we use just enough anesthetic where you don't feel a thing, but your body can heal. Then, once we take out the infected tooth, we clean it with ozone water,
Correct.
ozone gas. Then we draw blood. We use your own blood and we spin out the healing proteins
Okay.
called PRP, platelet-rich plasma,
Plasma.
or platelet-rich fiber. And that is almost like a supercharged healing part for your body. Put that
Correct.
into the socket,
It's your
and
own.
now your body has everything it needs to perfectly heal without bacteria or viruses or whatever they may be, and you end up with a good result.
Yeah.
The next day, you take it easy. You do another protocol. You maybe get a lymph massage. You do another IV. So we support the body for healing. So when you do a biologic extraction, you are not just pulling the tooth, because often when I see patients who had that done, I have to fix it. To go in the bone, I have to clean out the infection. I have to put them on the same protocol. I have to pull the same healing proteins out of the blood. I have to put it back into that socket, or you get chronic inflammation. What's chronic inflammation? The root cause of all disease.
Exactly.
So
Exactly.
biologic dentists just do everything in that kind of format. Prevention, no toxic chemicals, make sure you're healthy enough, and the most important part, we find the root cause. If I can't find the root cause of what's
No
going
pun
on,
intended.
I'm not. Yeah, no pun intended. It's actually great. Yeah, we find the root cause. We remove the root cause.
Yeah. That's right.
If I can't find out why something is wrong, how can I fix it? I can't.
So the mouth will tell you a lot, but also, and an X-ray, the 3D X-ray that you take, tells you even more. But then listening to the patient is part of the protocol.
It's required. I work for the patient.
Yeah.
They hire me to help them find what's going on in their life. Too many patients tell me they're intimidated by the dentist or the doctor telling them what they need to do. No, you are my boss. Okay, I work for you. Make that very clear.
Yeah.
This is a very specific relationship. If I can serve you correctly, if I can fix what you're coming here for me to fix, I'm not going to just do random dentistry
Yeah.
to make money. I'm here to make you feel better and get healthier so you can get away from me as soon as possible, because we both know you don't like to be here,
Yeah.
and live your life on your terms.